Hi. This presentation is about Medicare supplement insurance, how to pick the right plan and get the best rate. And we'll also share a few Medigap secrets that might save you a bunch of money too. Now, what we'll be talking about today is a tool that is available to you for free because you are a card holder at the Barrington Area Library. So we'll talk a little bit about what this tool can do for you and how you can get a copy of your own report. So let's get started. Okay, so I work for a company called Greyhouse Publishing. Greyhouse is a reference publisher, so we produce encyclopedias, reference titles in print, and online databases that libraries subscribe to. So I'm not here to sell you insurance. We have no connection to the insurance industry at all, except for the ratings that we publish. So the tool that we'll be talking about today is a Medigap pricing tool and insurance ratings that are independent, unbiased, and accurate. So this Medicare and Medigap discussion is designed to help you navigate through the Medicare maze. Oh, before we get started, I'm going to go through the presentation and I just ask people to hold questions until the end. You can type your questions in the chat bar if you would like to as we go, but at the end of the presentation, then I'll go through and we can discuss all of your questions in the chat, or you can unmute yourself at the end of the presentation and then we can go over your questions. Okay, so back to the presentation. So our primary goal is to tell you about the choices you have available to you and help you save as much money as possible. At the end of this talk, you'll be able to download your own customized Medigap report that can help you find and select the best Medicare supplement insurance policy for you with the strongest companies for the least amount of money, and you can do it for free with your library card. Here's what we'll cover. The major expenses that Medicare doesn't cover. When is open enrollment and what does that mean? Why Medigap can be better than Medicare Advantage, and how to get lower premiums and save hundreds, even thousands of dollars. So where do we start? Let's start when can you join Medicare? And your initial enrollment period is the 3 months before your 65th birthday, the month of your 65th birthday, and the 3 months after your birthday. Now, each year there's an open enrollment period that runs from October 15th through December 7th. So if you didn't sign up during your open enrollment or your initial enrollment period, you can sign up each year during that time. But if you're still working and you're covered by your employer's insurance, Medicare can supplement your employer coverage. So you can still generally sign up for Medicare Part A, even though you're still working and have coverage through your employer. So you might ask yourself, if you have a Medicare plan now or Medicare supplement insurance, what happens if you want to change your plan? So if you have a Medigap plan now and want to change your plan or your insurer, you can do so during open enrollment each year from October 15th to December 7th, and your new coverage will start on January 1st. So let's take a closer look at Medicare itself. Medicare is divided into 4 parts. Part A is your hospital insurance. Part B is your medical insurance. Medicare Part C, now that's Medicare Advantage. And Medicare Part D is prescription drug coverage. So Medicare Part A, that's your hospital coverage. So it covers hospital-related services and emergency care, like inpatient hospitalization, home health services, skilled nursing services, and hospice. But Medicare Part A does not cover all of your hospital costs, and it does not cover long-term care. Medicare Part B, that's your regular doctor visits and medical care. So that covers your regular medical care and helps with outpatient services like doctor office visits, laboratory services, ambulance, and diagnostic services. So if you have Part A and Part B, you think you're totally covered. But Medicare does not cover all of the costs associated with hospital and medical insurance, and it does not include prescription drug coverage. These are some examples of out-of-pocket costs for 2021. So if you have a hospital stay, you'd be responsible for the first $1,484 for your hospital deductible. You have a Part B annual deductible of $203 per year. You would pay out of pocket for 20% usually of outpatient services and medical supplies. And you have your Part B monthly premium, which is $148.50 depending on your income. So these are some examples of what you would pay out of pocket if you have Medicare Part A and Part B and need medical care. And there are some other hidden costs. None of these things are covered, like prescription drugs, vision, emergency care abroad, dental, and hearing aids. These are not covered by Medicare. But you have choices and your individual needs will vary. When Medicare was established in 1965, it was never meant to cover all of the medical care for your senior years. It was intended to cover only the most basic of needs. And you have choices in regards to your health care. You can stick with Medicare Part A and Part B, or you can purchase additional coverage. And you can make this decision based on your unique healthcare needs. So if you're interested in supplemental insurance, you generally have two choices to fill the gap. Medicare Advantage, which is Medicare Part C, and Medicare Supplemental Insurance, also called Medigap. Medicare Advantage, or Part C, that's coverage provided by private insurance, and it's limited to a defined network of doctors and providers. It combines your Part A hospital insurance, your Part B medical care, and oftentimes Part D prescription drugs. On the other hand, Medicare Supplement Insurance, or Medigap, that covers deductibles, co-payments, and co-insurance, and it's designed to fill in the gaps that Medicare Part A and Part B doesn't cover. So let's look at them side by side. On the left-hand side, you have Original Medicare plus Medicare Supplement Insurance, or Medigap. Now, those plans have higher premiums, but they don't have copays. You have the freedom to choose your doctor, and that means that every doctor who accepts Medicare also accepts Medicare Supplement Insurance. No referrals are necessary, but some routine services are not covered, like vision and hearing. But you're covered everywhere in the United States, and 6 plans offer coverage abroad. So if we look on the right-hand side, Medicare Advantage plans, they generally have lower premiums, but they do have copays. So that means that with each doctor office visit or referral to a specialist, you'll have to pay a copay to those providers. You may be restricted to a network, which means that some doctors would not be covered under a particular Medicare Advantage plan, and you may need referrals for specialists. But many of the Medicare Advantage plans include extra benefits like vision, hearing, or fitness. But outside of your service area, you're limited to emergency services only. So that brings us to secret number 1, that Medigap plans offer identical coverage. Currently, there are 10 Medigap plans, each known by a letter A through N. And 2 plans, F and G, each have an additional high deductible option. For every lettered plan, every insurer that offers that plan provides the same exact benefits. The plans are regulated by the government, so the coverage within each lettered plan is the same regardless of which insurer you choose. So that means that all Plan A's have the exact same coverage. All Plan B's are exactly the same. All Plan F's are the same. All Plan G's are the same. That means you can compare the insurance companies side by side because they're offering exactly the same benefits within that plan. And that means that you can pick the plan that has the coverage you want, you can compare one insurer to another, and you can pick the plan that has the best rate. So you might ask yourself, well, which plan is right for me? And there's a couple of ways that we can kind of point you in the right direction. So here are some questions that you might want to ask yourself. The first one is, what is your income? And using your customized Medigap report that we'll be able to download together at the end of this presentation, you can shop for a Medigap plan that has the most benefits that will fit within your budget. The next question is, do you think you will want or need nursing care? And that's kind of a hard question to answer because, no one has a crystal ball about what's going to happen in the future, but you can look at your family's medical history. If your parents or grandparents needed nursing care, you may also need similar care in the future. And another question is, do you travel a lot overseas? Now, mind you, no one's doing a heck of a lot of traveling in the middle of a global pandemic, but hopefully we'll move beyond this and people can travel again. But if you do plan on traveling overseas, you can get coverage for emergency care in a foreign country with plans C through G, M, and N. So when you're deciding between Medigap plans, you can decide to pay a higher premium for more comprehensive coverage or pay less for your premium and potentially pay more out of pocket. So let's take a closer look at plans A through N. So these are the Medicare Supplement Insurance Plans, or Medigap. And these checkoff boxes are a summary of what the individual plans cover. So if we take a look at Plan A, that has the least amount of coverage. So we have 4 checkoff boxes here. So that means that every single Plan A covers your Part A coinsurance and hospital costs, your Medicare Part B coinsurance or copayment, the first 3 pints of blood, and Part A hospice care coinsurance or copayment. Plan B adds your medical part or Medicare Part A deductible. That's that $1,484 that you would pay out of pocket if you didn't have a Medigap plan. Plan C adds some extra benefits. And then let's take a look at plans F and plans G. Now, these are the most comprehensive Medicare supplement insurance plans because they have the most checkoff boxes here. They're also the most popular plans because they have the most comprehensive coverage. And the only difference between Plan F and Plan G is this little box right here, which is Medicare Part B deductible. That means that Plan F, the insurance company pays it for you and charges you a fee to do that. But with Plan G, you pay that $203 Part B deductible out of pocket as an extra fee. So that's the only difference between F and G. We'll talk more about that later. So what I did earlier today was I downloaded a Medigap report from the Barrington Area Library website. And part of that report includes pricing for what the individual plans cost from every single insurer that offers those plans in your area. And I included the least expensive plan or the least expensive insurer for each one of the plans that I saw. So here, if we look at Plan A one more time, the least expensive insurer I found for a 65-year-old female, and your rates are going to vary, was $900 per year. So let's bounce over to Plan G. And again, this is the most comprehensive plan. And this cost $1,175 per year for this same 65-year-old woman. So for just an additional, $275 per year, this particular person could have the most comprehensive coverage that the Medigap plans have to offer. So that's just a summary of how the plans stack up to one another. And you'll have access to this information when you download your own report so that you can compare the plans side by side and how they would, most line up with your medical needs. Okay, so that brings us to secret number 2, and that is that Medigap plans are standard, but the rates are not. insurance premiums can vary by thousands of dollars a year for the exact same coverage, which I find to be crazy. The government regulates the plans. So every plan A is the same, every plan G is the same. But what is insane is that the pricing is all over the place. And you're not getting any extra benefits from one or the other because the plans are regulated. So, some insurance companies just charge you more for the same exact benefits. So what we're here to do is help you shop around to make sure that you're getting the best rate for the coverage that you want. So here's an example. This same 65-year-old female living in Barrington, if she's interested in Plan G, the most expensive plan that I saw was $4,433 per year, compared to a different insurer offering Plan G for $1,175. That's a savings of $3,258 per year and a $32,000 savings or dollar savings over 10 years. It's crazy. And another example, a 68-year-old male, also in Barrington, if he's interested in Plan A, which again is the least amount of coverage, the highest premium I saw was $4,785 compared to $1,116, a savings of $36.69 per year and over $36,000 over 10 years. Now, if a couple is interested in Plan G, the highest premium I saw was $9,429 per year. The lowest was $2,500 per year. That's a savings of almost $7,000 per year between the two of them. Now, let's say again that these Plan Gs are exactly the same. One just costs more for the same exact benefits. So it really does pay to shop around. And again, that's almost $70,000 over 10 years. I can think of a whole bunch of things that I would like to do with 70 grand. So the next question is, how safe is your insurer? And that's where Weiss safety ratings come in. Weiss Ratings has been rating the financial strength of the insurance industry for over 50 years now. So we collect financial data from every single insurance company who operates in the US, and we look at the strength of their financials. So we are looking at, how they can weather a moderate or a severe recession. Are they going to be there for you years and years down the road? So our safety ratings use a pretty standard report card style grading mechanism. So A is excellent, B is good, C is fair or average, D is weak, and E is very weak. And we can be kind of like a mean teacher where it takes a lot to get an A rating from us because our ratings are very conservative. So that brings us to secret number 3, that safer insurers are not necessarily the most expensive. And higher premiums don't mean that you're getting coverage from a stronger, more financially stable insurance provider. It's actually the opposite. And secret number 4 is that you can make the choice. You can get more coverage for less, reduce your premium, and balance the financial safety of your insurer with your choice of plan. So let's go over the 4 secrets one more time. That Medigap plans offer identical coverage. The Medigap plans are standard, but the rates are not. Safer insurers are not necessarily more expensive, and you can make the choice. So now we're just about to go ahead and download a sample Medigap report from Weiss Financial Ratings. And our goal is to help you make the right choice for you and your specific situation. You can pick the right coverage, you can pick the lowest rate, and you can save valuable time and money. And you can pick the best and most affordable plan from all available providers customized just for you. And you can get it for free with your library card because Barrington Area Library subscribes to this helpful tool. Now, before we move on, there are some questions that we should tackle now. There were some recent changes last year surrounding plans that are available to various people. So if you were eligible for Medicare after January 1st, 2020, Plan C, Plan F, and high deductible Plan F will not be available to you. If you were eligible for Medicare before January 1st, 2020, you can continue to enroll in Plan C, Plan F, and high deductible Plan F. But, if you were eligible after 2020, you can consider Plan D instead of Plan C or Plan G instead of Plan F. And the only difference is, like we discussed before, is the $203 Part B deductible that is covered in Plan F and is not covered in Plan G. But one thing to note, because Plans F and C are no longer taking on younger, people who are just turning 65, that will mean that the average age of someone who is eligible for Plan F is going to increase year over year as we, get further away from 2020. So it's very likely that the cost of Plan F will continue to rise, and the cost of Plan G will, be generally less than Plan F. So, we just wanted to make sure you were aware of those changes and, be able to kind of stack up those two plans side by side and know what the differences are. Now, the solution offered by Weiss Ratings in their customized Medigap report is to help you find and select the best Medigap policy for you with the strongest companies for the least amount of money. But naturally, every person's situation is unique. So if you have more questions, we urge you to first talk to your doctor about your future healthcare needs and make sure that the plan that you're selecting will give you the coverage you need. You can also talk to the insurance company that you've selected to make sure that your specific questions are answered. And you can also talk to a SHIP counselor, and that stands for State Health Insurance Assistance Programs, to get personalized one-on-one Medicare counseling over the phone or in person to help you further. Now, you can locate a SHIP counselor in your area by visiting this website, which is www.shiptacenter.org, and click Find Local Medicare Help, which is in the upper right-hand corner of their homepage. Okay, let's go ahead and get a copy of the Medigap report. To download your own, you would start at the Barrington Area Library website, click on the Databases button, and select W in the A to Z menu, or you can click on Business and Careers. Scroll down and click on Weiss Financial Ratings. Then you'll enter your library card if you're connecting from home. Click on the Medigap tab, which is in the gray bar on the right-hand side. Enter your information and download your report. Let's do one together. Okay, I'm going to go ahead and share a different screen. Okay, so you should see the Barrington Library here. So I'm going to click on Databases, which is up here in the upper right. And you can click on W in this A to Z list, or click on Business and Careers up here in the category. And then here we are with Weiss Financial Ratings. So that's where you're going to go. Now, if you're connecting from home, you'll enter your library card number here, and then that will give you access to our database. Now, we are doing the Medigap tool here. So you're going to look for the gray bar at the top, and then click the Medigap button on the right-hand side. Okay, so that brings you to the Medigap report generator. Now, we don't collect this information in any capacity. It's used to just personalize the front page of your report. If you're not comfortable putting your, oh, that's my dog saying hello. If you're not comfortable putting your information here, you can enter a nickname or your initials or what have you. So I'm going to enter sample patron. Now, the report can be anywhere from 60 to 80 pages. If you would like a copy emailed to you, you can enter your email address here. Without a typo. And then you'll enter your age, your gender, and your zip code. So I'm going to enter 60010. And click the Get Report button. And that will swirl for a bit, and then you can download a PDF of your report. So this is an example of the report that I generated earlier today. And okay, let's look at our bookmarks here. Okie dokie, so let's take a look at each of the individual sections. So the report starts with 4 key decisions that you will want to make when you're considering Medicare supplement insurance. Decision number 1 is, should I seek to get better health insurance coverage than Medicare alone can give me? Decision number 2 is, how should I cover that gap between my medical bills and what Medicare pays? Decision number 3 is, which Medigap plan should I choose? And decision number 4 is, which insurance company should I buy my Medigap plan from? The next section of the report is a lengthy section on what Medicare covers. So, if you're new to Medicare, or maybe you're turning 65 next year and you want to, make some estimates of, well, what is my out-of-pocket cost going to be? And, how can I compare that to what the cost of the supplemental insurance plans are? So this report gives you a long list of medical procedures, what Medicare pays, and what you pay out of pocket. So you can use this as a tool to kind of estimate, what your out-of-pocket costs will be. And there's a fairly long list of procedures and costs associated with them. So the next section is, what are the gaps in coverage? And this section will talk about, how you can potentially fill those gaps. And then that brings us to, which Medigap plan should you choose? And this is the same grid that we were looking at as part of the presentation, with Medigap Plan A, of course, is the least comprehensive. And then plans F and G are the most comprehensive, with the obvious difference being this Part B deductible, which is not covered in Plan G, but is covered in Plan F. And the most important section are the rates. So there is a chapter in this report that covers each of the individual plans. So you'll start with a narrative of what that plan covers, and then that moves on to a long list of every single insurer that will cover you and your area, and how much that plan costs per year. Now, this is organized by our financial safety rating. So this first section is, this is Plan A, or providers of Plan A who have a B- or higher safety rating. And it's organized by price. So you can see that this Blue Cross Blue Shield of Illinois has the least expensive Plan A at $900 per year, compared to, let's say, here's Aetna at $1,906, so a full $1,000 more. And again, all of these Plan A's are exactly the same. The coverage is identical between one insurer to another. Some of them just cost more. Then we have a section for companies with a safety rating of C- to C+. Now that's not a bad rating. That's an average rating. It's, the middle of a bell curve. Now here you'll see these two asterisks throughout the report. And that means that this is an AARP plan. AARP only underwrites their Medicare supplement insurance through United Healthcare. So, if you get a mailer or, something advertising Medicare supplement insurance plans through AARP, United Healthcare is the place where you would get your insurance from. Now, in this case, their rates are pretty decent compared to some of the other insurers. You can still save a little money on Plan A if you went with Blue Cross Blue Shield. But, if you wanted to go with AARP, then, that's a pretty reasonable rate. Compared to those on, the very high side, there are plans, in the $2,500 range. And again, for the exactly the same coverage. So let's hop over to Plan G. And again, you have your narrative about what that plan covers. And then let's take a look at the pricing. So Blue Cross Blue Shield is again the least expensive with companies of a B- or higher at $1,284. This is only a couple $100 more than the Part A or the Plan A's, which had the least amount of coverage. And Plan G, again, is the most comprehensive. And then if we keep scrolling, we're comparing this $1,284 to National Guardian at $1,642, Country Life at $1,755, so on and so forth. So, what this report is really designed to do is to do all the shopping for you so that you don't have to make 80 different phone calls to 80 different insurance companies. You can get all of the pricing that you need and be able to know that, you're getting the best deal for the coverage that you want. Now, if you do want to contact the insurance companies that are listed, we do provide an index of all of the insurers at the end of the report with their phone number so that, you can contact them with any questions that that you have, or go ahead and select a plan, so on and so forth. So that is an example of the report that you'll be able to download. Let's go ahead and just look at those directions one more time. So we're going to start with the Barrington Area Library website. We're going to click on Databases. And then you can either go to the Business and Careers up at the top, or click W, and then we are Weiss Financial Ratings. Enter your library card if you're connecting from home, and then just make sure that you click on the Medigap tab, and that's where you'll be able to download your own report. So thank you very much for sticking with us through this whole presentation. I'm going to go ahead and maybe read through some of the questions in the chat. And pricing method, sure thing. Okay, let's go back to Plan G. Okay. Now, one thing that I should point out, some of these monthly premiums say NA. Now, that does not mean that monthly pricing is not available. It just means that the insurance company has not provided that number to us. So I would recommend, if you have questions about, the monthly cost, to call the insurance company directly, not to just assume that this NA means it's not available to you. But in the beginning of this section, okay, let's move this over. So these are the three kind of pricing methods. So we have attained age rating. So this type of policy, the premium will get more expensive as you age. So you'll pay less at 65, but you'll pay more at 80. The issue age rating, the insurance company will charge you based on the age you were when you first signed up. So that means that, if you sign up at 65, your rate is going to stay the same until you stop getting the policy, but that also means that you will typically pay more at 65 than you would with the attained age rating, but you're kind of locking in your rate. And then there's some ends thrown in there, which has no age rating or community rating, and that's the least common way. So, but again, you can, ask a question of the insurance company to say, is my price going to go up? And if you say that attained age rating, the answer is yes, that you'll typically have an increase each year. But if those plans that are listed as an I, typically not. Okay, next question is age your current age in 2021 or age in 2022? The rates for the Medigap plans change monthly. So for someone who is turning 65 right now, this would be what their rates would be right now. They usually go up a little bit year over year. So I'd recommend asking the insurance company directly, what will my price be if I sign up in June of 2022? And the next question is, in the ratings, what is U? That means unrated. So if we go back to there is usually a section at the very end for you, which is unrated companies. And that generally means that, there may be a filing that they, have been delayed on, or we don't have complete information on their financials to issue a safety rating. Could also mean that the insurance company is relatively new, because we do require, a certain amount of years to, come up with a solid rating. So those are just some of the reasons why you might see unrated companies here. So any other questions, anyone? Now, if you do want to ask a question, you just need to unmute yourself so that I can hear you, or you can just mouse over the Zoom app and then click the chat button, and that's how you could ask a question directly. Okay, well, I don't see any other questions in the chat. I hope that everyone, learned something tonight, and this tool will be helpful to you in the future. I'm going to go ahead and send a copy of the slides that we discussed tonight to the reference staff at the library. So if you did want to get a copy, then I would just suggest that you contact them and they can email a copy over. Yeah, and I wish everyone happy Medigapping and have fun in the database, and hopefully it'll help you in the future. Oh, we have one more question. Oh, Kate has shared her email, which is kmills@balibrary.org. And that's where you can email Kate, and she'll be able to connect you with a copy of the slides that we discussed tonight. So, and thank you, Bernadine. I'm glad you thought it was informative. I hope, it can help you all in a small way. So. Excellent.
All right. Thank you so much.
My pleasure. Good evening, everyone.
Have a good night, everyone.
You too. Thank you.
Thank you.